Philippines is one of the world's largest archipelago nations. It is home for more than 1 million Filipinos and people from different nationalities. Philippines is known to be a culturally diverse country, ranging from its biodiversity, coastal areas, majestic highlands, and emerging high-rise infrastructures. However, behind the glitz and glamour of this country lies a hidden dark reality. Behind the romanticizing paradise is a society of misery. Poverty, overpopulation, lack of education, corruption, and crimes all dwell in every corners of our country. All of this boils down towards the absence of family planning. Poverty and lack of education are the driving mechanisms towards an unequipped family planning, which may lead to an increased rate of population and low economic status. Every day, our population increases from a 1.68% population growth rate in 2016. It was at 1.45% between 2019 and 2020. Despite the rise in absolute numbers, the population grew gradually to 1.31% by the start of 2021. As the population increases, so as the fertility rate of the country. According to the Commission on Population and Development, a total of 2.80% of fertility rate, which resulted to the low economic growth of the country. Most of the families being affected by this dilemma had ought to have a low economic status. The University of the Philippines Population Institute and the United Nations Population Fund revealed that the number of expected unintended pregnancies is at 2,560,000, a surge of 751,000 due to the community quarantine-induced family planning services reduction. According to the article of Reproductive Health, 40.9% were not using any contraceptive methods to avoid pregnancy. Overall, the most prevalent reasons for non-use of contraceptives were health concerns and infrequent sex. Most of the barriers to contraceptive adoption are lack of access, lack of knowledge, fatalistic, and fear of side effects. In relation, teenage and unwanted pregnancy commences. Family planning is the ability of individuals and couples to anticipate and attain their desired number of children in the spacing and timing of their births. It is achieved through the use of contraceptive methods and the treatment of involuntary infertility. In this way, we will be able to establish a better life for our families, being able to support our children's needs, and can improve the country's economic development and sustainability. Contraceptive methods and prevalence. Contraceptions can be used to prevent pregnancy and will also protect you from sexually transmittable infections. Examples for these are using of condoms. This method of contraception can be used on demand. It is hormone-free and can easily be carried with you, and it comes in male and female varieties. The oral contraceptive pill. It is the little tablet taken once a day. The oral contraceptive pill is the most commonly reported method of contraception used by Australian women. The pill can have many benefits, however, remembering to take it on time is a must. Intrauterine device. This small T-shaped device is made from a material containing progesterone hormone or plastic and copper as it fitted inside a woman's uterus by a trained healthcare provider. There are also others which are contraceptive injections and sterilization. Health benefits of contraception. Contraception reduces pregnancy-related morbidity and mortality, reduces the risk of developing certain reproductive cancers, and can be used to treat many menstrual-related symptoms and disorders. Family planning programs. Family planning is now orchestrated as a part of a subject to be taught to students in high school until college. As early as possible, this matter should be taught towards teenagers in order for them to be well knowledgeable in this matter, since this upholds their responsibility as a parents in the future. Hospital health workers facilitate to educate every person in the country by providing seminars and lectures about the importance of family planning, the use of contraceptives, and the benefits we ought to be receiving. We are the authors of our lives. It is never too late to choose what is right. Plan for your future for the better.